Hello, everybody. My name is Steve Miller, and I'm coming to you from sunny South Florida. Today is Monday, the 14th of December, 2020, and it's about 5:15 p.m. my time. This morning, I underwent open cut surgery for my right side inguinal hernia with monitored anesthesia. It was sedation; it wasn't general. And I guess the surgery went well because I'm home, but there's a lot to tell, and I don't think we all are able to read enough about it from like average people on the internet because I searched and I couldn't find uh, very many people. Although my new friend Brett has a great video out, and I'll put a link to his video in the description on the bottom of this page. It's interesting. I don't feel any pain right now at all, but when I touch the wound itself, which is crazy glued shut, they don't seem to use stitches. Uh, at least in this particular facility, I was at the surgical center at Coral Springs. It was outpatient. I was in at 9:30. I was out at about 10 to 2, and it's very swollen, and I can feel it. It's also very numb. So I'm icing. I'm taking my Tylenol, and I have the hard stuff here if I need it. But I'm going to concentrate on getting through this thing without any kind of narcotic. I don't need that. I think they make you stupid, and I don't like the way I feel on pain pills. I think it slows your body down. It makes it difficult to do things that we all need to do, and body functions, normal daily body functions, and I'm going to pass that up unless it gets really unbearable. But I do want to tell you that, and I think it's important for people to post these videos because the crap you read on the internet is all crap. First of all, and this isn't meant to dissuade somebody from having the surgery, everybody should just know the truth. What I'm trying to say is that whenever you read an advertisement from a hospital or a group or something like that, try to explain that this is such a simple, easy surgery. Yes, it is. But make no mistake about it, it's treated like major surgery. And I think that's good for the patient, so I don't have a problem with that. But I was shocked when I was being prepped today. I finally said to the young woman who was prepping me, the nurse, I said, "This is like real surgery. They downplay it so much on the internet." And she said, "Yes, they do." It took them about an hour to prep me. I was hooked to every kind of machine with every kind of drip. I have no pre existing condition. I'm 65 years old. And, uh, and I mean, when they wheeled me into that OR, I mean, it was a room that was really, really well equipped in my layman's eyes and prepared for anything. But the fact of the matter is I had a lot of meds before the surgery. I know I had a pain med and an anti-nausea med that were put into my IV drip. And I also know that when they wheeled me in, they gave me a little Versed to relax me. They used propofol, which was an interesting medicine because I was talking to one nurse anesthesiologist and the other one said to me, "I'm going to put you to sleep now." And that's the last thing I remember till I woke up. But don't go in there expecting it to be like a snap your finger, drop in the bucket kind of thing. And I'm not ready to comment on the pain yet because when I touch it, I told you it's completely numb. I don't feel a thing. So I know there's some pain in there. I don't know how much, and pain doesn't frighten me. I mean, it's you treat it as it comes, and I just took two extra strength Tylenol. The doctor advised against any kind of ibuprofen or Aleve because he said that could make you bleed. But I'm not I wouldn't go to that anyways. If the extra strength Tylenol didn't work, I'd go right. What is it? I think it's Toradol. I'd probably cut one of those things in half and use them judiciously. Uh, but really, that's not on the schedule. The surgery went really well. I remember waking up in the recovery room and don't remember anything about the surgery. I also remember getting out of bed to get dressed when the nurse told me to, and wow, was I dizzy. And I would suggest having the surgery done at a place that's close to home because the ride in the car, at least for me, home was a little nauseating. I feel well now. I feel good now, and I hope it continues through the night. Only I know that there's going to be pain there later, soreness. Hopefully, it's just soreness. But I'm curious. I want to reference the type of painkillers, local painkillers, because he used local painkillers along with the conscious sedation. I'm curious what kind of painkiller lasts this long. I mean, this is amazing. At least it allowed me to have something to eat because I was really hungry. I hadn't eaten since like 4 o'clock the day before, and it's given me some time off. And what I'm trying to say here really is that expect it to be a lot more than you think it's going to be, but understand that that's for your protection and it's good. And there's nothing to be afraid of if you're in a good facility with a good doctor. I felt safe with my doctor, and I felt really safe with those nurses because they were all pros. I mean, every one of them. It was just an amazing experience, and I learned a lot about me because in my 65 years, I've never had surgery before. So I was frightened. I'm not going to bullshit anybody. I was definitely frightened, and I was frightened about a whole lot of nothing because it worked out really well so far, and I think it's going to be fine. I think I'm going to have some discomfort because it's part of the procedure, but I don't think it's going to be. Well, I don't want to say anything yet because if you say stuff like that, I have no clue what it's going to be. It's numb. But I'm going to chronicle my first 5 or 6 days of recovery. So people get the real deal, they get the real truth, and they know exactly what it is that's going on. It's really important to know, people. You need to know. Uh, it's nothing to be afraid of because I know the worst is over. The surgery has to be the worst part, and the prep has to be the worst part because it's that element of not knowing, and it's that little an anxiety feeling that you have when you're going in there not knowing what the hell's going to happen to you. But I found myself again to be well protected, and can't comment on the pain, but I will tomorrow. And I just I highly recommend it because I do know one thing: I don't feel that hernia anymore, and I don't see it either. I see a little bit of swelling, and it wasn't a big hernia. It was diagnosed 3 months ago when I tried to wait out the COVID to have it fixed, but that wasn't going to happen. And I saw that, so I thought it'd be best to have the surgery now before they lock down the surgery centers too. So this is the first post I'm making tonight, and there'll be 4 or 5 more at least until I feel someone like myself. I was told not to walk around today, which is contrary to what other doctors say, but I'm fine with that. Day's almost over. It's probably close to 6, and we'll go from here. So see y'all tomorrow, and I'll let you know how badly or how goodly it feels. Have a good night. Peace out.